Good evening, everyone. Today, me, Riddhi Agarwal, a fourth semester student of Masters of Arts of Public Policy from Mount Carmel College, Bangalore, along with my co-author Shrishti Khetrapal, a fourth semester student of BA in Economics Honors from Vivekananda Institute of Professional Studies College. We both have interned with We Citizens Foundation and Sarkari School for for a duration of 2 months. And in that duration, we have formulated a research paper on the title, on the topic Violence Against Children of Urban Areas in the Social Environment. It is a case study of Delhi. We have done primary research for the purpose of this study. And now I'd like Shrishti to take over and start with the introduction of the presentation. Shrishti?
Yeah, so I'll be talking about the introduction part of this research proposal. So basically, in this research proposal, we have focused on the theme of child rights. We have taken into consideration the topic violence against children of urban areas in their social environment, a case study of Delhi. So then, further, research on child abuse, the significance or the mindset we had before starting this paper was that it can offer scientific knowledge and also help us check the current status of society with respect to child abuse that can aid in the treatment of a wide range of psychological and social diseases. Further, it can help either improve or bring new laws into place so that abuse can be minimized or dealt with. Thirdly, in this research, we have noted the types of abuse children go through. We took an analysis of whether the incidents are reported or not and how children are affected on facing any abuse. It was observed that children do not have in depth information on child abuse. There were fewer suggestions on how to tackle this stubborn issue. So, as we carried our research using two methods of uh, strategies. First, it was using the primary research, and second, it was using the secondary data. So, the notings that what are the abuses children go through, whether the incidents are reported or not, and how are children affected by facing any types of abuse were found out by the Google Form survey, which we took for the children of classes 5th to 12th. Then this topic was is highly relevant and definitely an important topic because child abuse still is a very major problem in every other part of the country, and it's not even restricted to India, but also in several other countries where child abuse is still a very major and a stubborn problem. And this is very important to understand that individually that child rights play a very crucial role in nurturing a child's well being and providing them with greater care and security so that future development is done efficiently. So, as we know, that a country's growth and development is all dependent on the children's hand. Like, children are the future and the building blocks of a nation. So, everyone every citizen of a country should have full knowledge about what are child rights so that the future development is done more properly. Then I'll go on with the third slide, in which the first thing is talking about the significance of the study that it is observed that statistically it also observed that almost every country in the world is facing this issue and they're yet to define a model for its prevention. Like, even if we talk about India, there are many models, there are many committees which are formed for the prevention of child abuse, but they are not, going into a deeper root of the problem. So, achieving clarity in this area has also been an ongoing challenge. Thus, it is very crucial to understand the need to have knowledge on the same, and so that we can help the society grow better in terms of being aware of child rights. Secondly, the objective of our research proposal was basically twofold, and it aims to identify first the awareness amongst urban children with respect to different kinds of abuse. Second, to find out if children face any form of physical or verbal abuse in the immediate social environment of their household or educational organization. So, this was all done through our Google Form survey. Then I'll move on to the fourth slide. Then this talks about the review of literature. So the first paper was named as Understanding Child Sexual Abuse, Findings from an Ethnographic Research Among Mothers in Delhi. It was written by author Sonal Pandey and Sunita Reddy. So, in this research paper, it was basically focused on what are the mindset of mothers regarding the reportings of child abuse. If, for example, if any of their kid has gone through abuse, what are the mindset behind disclosure of the problems? Second, paper we came across and we have reviewed is child sexual abuse in India, which was written by Radhika Dayal and six other authors. So in this, it was basically they took child sexual abuse as the main topic of the research paper. Third paper we reviewed was Child Abuse, Effects and Preventive Measures by written by author Irfan Fayaz. In this paper, it was a very normal and basic paper which was written by him. In this, it was all written that what are the effects, which was, I guess, it was covered in our paper also, and the preventive measures by India, and also the individual ideas he has about this issue was thrown light upon. Fourth paper was we reviewed was child abuse and neglect in India, written by author Narendra Saini. He basically talked about that in a country like India, where there is a vast population, the reports of child abuse are very high, but still, it's a problem that is neglected on a large scale. Fifth paper we reviewed was Prevalence and Determinants of Child Maltreatment Among School-Going Girls in a Suburban Area of Delhi, which was written by Shehraz Daral and two other authors. So in this, they basically took surveys of school-going girls and talked about what types of abuse and what types of discrimination also they went through in their school uh, going times. And the last paper we had an analysis of was prevalence of child abuse, which was a review study by author Nisha Mari Ranjan and Dr. Jogendra Vati. So in this research paper, it was basically talked about how child abuse is still not, it's not a hidden part of our country, or it's not properly prevented in even in the 21st century. So that's it. These were all the research papers and journals we reviewed. Um, Further from fifth slide, Riddhi will continue.
Thank you, Srishti. So I will be talking about the research methodology of our paper. So we identified that the statement of problem was a high crime rate against children and the increases cases of abuse that we saw rising after the COVID year, especially. And in a Statista's report of 2021, it said that Delhi was the first area for which which reported highest crime rate against children, that is 128.5 per child against 10,000 children. And then the second city was Andaman and Nicobar Islands. So according to that, we chose the state of Delhi. Then the scope of our study is to study awareness regarding child abuse and the presence of violence amongst children in urban areas, so that we could draw some sort of policy intervention or actionable that we can introduce in the already and present policies and regulations. So this was the scope of our study. For our methodology, We did a qualitative research with two quantitative questions regarding the degree of harm felt by students, and also one question was related to the mental health impact on them. We surveyed this questionnaire through online and through an online method, and our study is a totally descriptive research study wherein we can only draw conclusive results for the group of study for the group of respondents we have collected our results from. Secondly, our sampling type was snowball sampling, where we, along with the people we knew, we sent them the questionnaire and then they forwarded the questionnaire to the people they knew. So this is the snowballing method of sampling. For the purpose of this study, we targeted private school students of urban areas of Delhi. We did not take a particular urban area because it would limit our research. So we kept the area indefinite, but it required to be an urban area only. The total number of responses that we received are 112 responses. There are certain limitations for the study. The first limitation which we faced was that we did not get responses, a lot of responses from class 5 to class 8 students. There were two reasons for it. Number one, they did not have a phone with them. So, because of which giving them the online form was difficult. Secondly, if we sent it to their parents, whenever the parents reviewed the questions, they were not very comfortable with the child answering these questions because they did not want it to be held accountable. Our second limitation was that we did not get permission from schools. Like if we approached one or two schools so that we could conduct the research for formal like for ethical purposes, but we did not get any permission. Reason being, again, the schools did not want to be held accountable because of the verbal and physical abuse questions we have with respect to the school. Our third limitation was that a lot of vast research has been done over the years in the field of child abuse, and it was very difficult to narrow down our or pinpoint the gaps and also address them. So that was another challenge we faced. Now, if we talk about results and discussions, so according to our research paper, our objective were twofold, and we talk about awareness and presence of abuse. So when we studied the data for presence of abuse for the awareness, we realized that the children are approximately 76% of the respondents were aware of what is child abuse and different types of child abuse. And 18% of the respondents were more or less aware. There were only merely a 6% of respondents who did not know what is child abuse. But when we took another question with respect to it about how are they taught about child abuse, or what are the formal, if there is any formal system of channel through which they are taught about child abuse, there we saw that only 38% of the respondents said that they had proper awareness regarding it, but 62% of the children did not think that they had any kind of proper awareness regarding child abuse, and whatever they have learned is by themselves. So we realized that even though awareness is there, but proper channels and programs for creating this awareness lacks till now. Then in the second objective, when we checked presence of abuse, so first was to check if physical abuse is present within household and within the school educational organization. So there we saw that 44% of our respondents were physically abused either in their schools or in their households, and 56% were not abused. Again, in our verbal abuse, we saw that 46% of children were verbally abused in their household or schools, and 54% of them were not. We also had another question which talked about how many of these children report the how many of these children report abuse, and the total number of children abused or the respondents abused. So there we saw that 77% of our respondents, which is approximately 86 number of children out of 112 responses, are either physically or verbally abused, and only 23% of this population, sample population, is not abused. So it was very disheartening to see the results, knowing that 77% of private going school students were they are educated properly, where they have all the resources, are still being abused in their household or their school institutions. Next, when we talk about, if we have to also look at the analysis, uh, from the review of literature, we found that in the paper of a review of study, the last one, we saw that they said that um, child abuse is largely present in the urban cities of India, but the severity of it is very less comparative to the rural areas. So, according to our studies and according to our primary data collection, we found that we have some sort of similarity between both the results. That yes, the urban area cases are also large, but the severity is low. How do we define the severity? We through the question that we had regarding the effect on their mental health, we and the brutally harmed, the degree of harm, we saw that a lot of children responded they were less harmed or moderately harmed, and that for the mental health, they felt very quiet or guilty or felt very anxious. So we know that the severity is comparatively less, but the cases are a lot in urban areas. So our review of literature matched with our data collection. Now, when we talk about policy suggestions, the, the analysis of the study helped us understand that there is a very lack of proper channels for awareness. For example, a school might not include in the curriculum or in their moral science teaching, they do not include anything regarding the child abuse issue. They do not teach children what is abuse and what is not. And we understand that schools play an important role in creating awareness and identifying abuse. Reason being, they are well trained professionals who can create a who can create an understanding within the students from a younger age, that and help them identify what is abuse and what is not. Also, we realize that education is a very important factor to build an understanding of sensitive issues. Reason being, a person who is educated can understand the reasoning, nitty-gritties, um, and the overall picture, and can look at it from the same framework. Now, for the policy recommendations or interventions that we have chosen, and after studying all of the present regulations and frameworks, the first policy recommendation that we would suggest is the training within the healthcare system. So we would like the professionals of the healthcare system to be trained as well. The second is awareness and training for the parents through these healthcare systems or in schools. The third is changes within the integrated child development service schemes, ICDS schemes, where they follow the Anganwadi system and include a child abuse sectionality there. Then the intervention of local government bodies should also become present. Like people should be able to go to local government bodies, or children should be able to go to local government bodies in order with their grievances because they do not feel safe with the police sometimes. And last, involvement of school counselors to understand the uh, level of abuse, and also they will also connect with the local government body so that schools cannot suppress any information. Conclusion for this is that the child abuse issue requires immediate attention from all stakeholders, including government, civil society organizations, and children, because it poses a threat to the well being of children and their physical, psychological, and emotional development and the future. It is a need for more, there is a need for more research to understand the nature and extent of child abuse in urban areas and develop evidence based interventions to prevent and respond to it. The three key learnings for me, for our team, throughout this research study is that child abuse is in verbal and physical form is still very present in our society, and children are afraid of informing about it. The third is that children feel trapped, and if they try to approach the problem, they are more than often neglected. The third is that it is a global problem, and within each society, it needs to be tackled differently because of its culture, its demographic, and other resources. With this, we'd like to conclude and hope that this creates an impact in our society and also helps for future researchers who